Recognizing when somebody's dealing with mental health problems is the subject of this special instruction at the Shreveport Police and Fire Academy. First responders are getting crisis response training to help individuals in distress. Our Madison Edwards spoke with some crisis trainers to learn how they're helping officers assist anybody in distress. So, Madison, this is pretty important stuff.
It is, Jeff, and it also helps public safety as well as officer safety. CRIT teaches officer safety and public safety, like I said, and diversion from the criminal justice system when possible. Utilizing nonprofits and mental health specialists in our area, trained officers use active listening skills and empathy to de-escalate situations.
A lot of this program is actually based around officer wellness itself, because you can't help somebody else if you haven't helped yourself first.
Crisis response and intervention training is designed to prepare police officers' responses to people experiencing crises related to behavioral health conditions, substance use disorders, and intellectual or developmental disabilities.
People will pull up and not be able to recognize certain mental disorders or intellectual disorders, and the situation goes poorly for everybody involved.
Officers are encouraged to make connections, enhance their awareness of the situation, and emphasize de-escalation techniques to support officer safety as well as the safety of the individual. A core tenet of the program is active listening and conversation.
Active listening is definitely the foundation of all of this. Transparency, I can't say it enough, transparency. And the final point is, our final product is just resources. Knowing what's out there, because in the past it was hospital, jail, and that's it. That's not what it is anymore.
CRIT trainers work with numerous nonprofits like The Bridge to help officers identify signs of Alzheimer's and dementia, and the Council on Alcoholism and Drug Abuse, who will roll out a mobile crisis response unit to help those who call 988 to find solutions outside of the hospital or jail.
Jail or the hospital isn't always the best option for some people. So let's give them the option. Let's give them other places to go. Let's go and start making our phone calls, and let's connect the community with other partners, and let's get them moving on that and really come together as one.
Officers with CRIT training can be requested to assist with any call for service.
If you want a CRT officer, ask for one. We'd be happy to send one out. On our roll call sheet, we have every officer's name and where they're going to be, and then right beside them, CRT.
The program is free for any first responder in Northwest Louisiana. Trainers say these methods will help officers relate to the situations people may be going through to prevent crises from escalating. Jeff, back to you.
All right, this sounds like training that's going to help everybody.
It is a part of things that we do every single day: active listening, conversation, communication.
Very good. Thanks, Madison.